Stop scrolling. Because what I'm about to tell you in the next few minutes could directly affect you, your parents, or someone you love deeply. The U.S. Senate just passed one of the biggest elder care bills in years, and most people have absolutely no idea what's inside it. We're talking about changes to Medicare, home care support, nursing home regulations, and financial protections for millions of seniors across the country. Some of this is incredibly good news, but some of it comes with deadlines, fine print, and rules that could trip people up if they're not paying attention. So stay with me, because by the end of this video, you're going to know exactly what changed, what it means for your family, and what you need to do about it right now. Let's get into it. Here's the thing about elder care in America. It's been broken for a long time. The average cost of a nursing home in the United States? Over $90,000 a year. Home health aides? Thousands of dollars every single month. And Medicare, the program tens of millions of seniors rely on, doesn't cover nearly enough of it. Families are draining their savings accounts. Adult children are quitting jobs to take care of aging parents. Seniors are going without medication because they have to choose between pills and groceries. This is the reality for millions of households right now, and Congress has been arguing about fixing this for years. Well, something finally moved. The Senate passed the Elder Care and Senior Protection Act, and whether you're 65 years old or you have a parent who is, this affects you personally. I'm going to break this down into clear, simple sections so you understand exactly what's in this bill, who benefits, who might get left behind, and what you should do starting today. Stay with me. Because Section 3 of this breakdown, that one caught even experts off guard. Let's start with something that affects the most people. Right now, if an elderly person needs help at home, someone to help them bathe, cook, take their medication, get around the house, most of that cost falls entirely on the family. Medicare barely touches it. Medicaid helps, but only if you're already broke. That's the cruel trap millions of families fall into. Well, this bill changes that picture in a significant way. The new legislation expands Medicaid home and community-based services, what policy people call HCBS, in a way that hasn't been done in over a decade. What does that mean in plain English? It means more seniors will qualify for in-home care support. It means longer hours of assistance covered. It means your mom doesn't have to go into a nursing home just because the family can't afford a full-time caregiver. Imagine this. Your father is 78. He had a small stroke. He's mostly okay, but he needs help getting dressed in the morning. He needs someone to drive him to doctor's appointments. He needs medication reminders every day. Right now, without significant financial support, that falls on you. Maybe you're driving across town every morning before work. Maybe your spouse is frustrated. Maybe you're exhausted and terrified that one day you're going to miss something important. This bill starts to address that exact situation. But here's what you need to know. These expanded benefits are not automatic. You have to apply. You have to know they exist. And there are income-based rules that vary by state. We'll talk about what to do at the end of this video, so keep watching. This next part might make you a little angry, and honestly, you have every right to be. For years, nursing homes across this country have been understaffed, underfunded, and in some cases, outright dangerous. After COVID, the situation got worse. Staffing shortages hit hard. Elderly residents sat alone for hours. Some families couldn't visit for months. And watchdog reports showed incident after incident of neglect, falls, medication errors, patients developing severe health complications from lack of proper care. And what happened to those facilities? In many cases, nothing. This bill changes that. The Elder Care Act introduces mandatory minimum staffing requirements for nursing homes that receive federal funding. That's the vast majority of nursing homes in America. Here's what that means in real terms. Facilities will now be required to have a registered nurse on site 24 hours a day, 7 days a week. They'll need to meet specific staff-to-patient ratios, and facilities that fall short face financial penalties, real ones, not just a slap on the wrist. There's also new transparency requirements. Nursing homes will have to publicly report staffing levels, inspection results, and complaint records in a format that's actually readable by regular people, not buried in government databases. So if you're trying to find a safe facility for a loved one, you'll actually be able to compare them side by side. Now here's the uncomfortable truth. Some facilities are going to struggle to meet these requirements quickly. Smaller nursing homes, especially in rural areas, may face real challenges hiring qualified staff fast enough, which means, in the short term, there could be disruptions. If you have a loved one in a nursing home right now, pay attention. Ask questions. Request their latest inspection report. You have that right, and now it's going to be even easier to get that information. Don't assume everything is fine just because nobody called you. Okay. I told you Section 3 would catch people off guard. Here it is. One of the most quietly powerful parts of this bill deals with prescription drug costs for Medicare beneficiaries. Building on the momentum from the Inflation Reduction Act, this new legislation takes another step toward capping out-of-pocket drug costs for seniors. Here's the situation right now. Even with Medicare Part D drug coverage, seniors can end up spending thousands of dollars a year on medications: insulin, heart medication, cancer drugs, blood thinners. There are seniors skipping doses, cutting pills in half, ordering medication from other countries because they simply cannot afford what's being charged here. That is not a third world problem. That is happening right now in American suburbs, in small towns, in retirement communities. The new bill expands drug cost caps and strengthens Medicare's ability to negotiate prices on a wider range of medications. What does that mean for you? If you're on Medicare and you take ongoing prescription drugs, especially for chronic conditions like diabetes, heart disease, or arthritis, your costs could come down noticeably. But, and this is critical, these changes don't happen overnight. Some provisions phase in over the next 1 to 2 years, and whether you benefit depends on what medications you take and your specific Medicare plan. This is why I'm going to say something very clearly right now. You need to review your Medicare plan this open enrollment period. Open enrollment happens every year from October 15th to December 7th. That window is where you can switch plans, upgrade coverage, or make changes that take effect January 1st. Miss that window? You're locked in for another year. Don't let that happen. If you're not sure how to review your options, call 1-800-MEDICARE or go to Medicare.gov and use their Plan Finder tool. It's free, it's not complicated, and it could save you thousands of dollars. This one hits different because we don't talk about it enough. Elder financial abuse is one of the fastest growing crimes in America. We're talking about billions of dollars stolen from seniors every single year. And it doesn't always look like a scammer calling from overseas. Sometimes it's a family member quietly draining a bank account. Sometimes it's a so-called financial advisor recommending bad investments that line their pockets. Sometimes it's a caretaker who gains trust slowly and then takes advantage of it. The Senate bill includes new provisions that give adult protective services more funding, create stronger reporting requirements for banks and financial institutions when they suspect elder financial abuse, and increase penalties for people convicted of financially exploiting seniors. For the first time, there's also a push to require more training for bank employees, the people who are often the first to notice when something seems wrong with an elderly customer's account. Imagine this scenario. An 81-year-old woman starts making unusual withdrawals, large amounts, multiple times a week. A bank teller notices, but under current rules, there's limited action they can take quickly. Under the new framework, that teller has clearer authority to flag the account, slow the transaction, and alert protective services before the money is gone. That's a real meaningful change. If you have an elderly parent, especially one living alone, here's what I want you to do. Talk to them about this, openly, lovingly. Set up account alerts with their bank. Become an authorized person on their account, not to control it, but to monitor it. And if they're working with a financial advisor, make sure that person is a fiduciary, someone legally required to act in your parents' best interest, not their own. This conversation is uncomfortable. Have it anyway. Here's a group of people this bill is also trying to help, and they're often completely forgotten in this conversation. Family caregivers. Right now, an estimated 53 million Americans provide unpaid care to an elderly or disabled family member. 53 million people. Many of them have reduced their working hours. Many have left jobs entirely. Many are burning out silently, without any financial support or recognition for what they're doing. The Elder Care Act includes a new tax credit framework for family caregivers. If you're spending significant money out of pocket to care for an elderly parent, on supplies, home modifications, respite care, you may be eligible for a tax credit that helps offset those costs. There are income limits. There are qualifying conditions. But for many middle-class families who've been absorbing these costs quietly for years, this could be genuinely meaningful relief. The bill also funds more respite care programs, temporary relief services that give full-time family caregivers a break. A few hours, a weekend, enough to breathe. Because here's the hard truth. Caregiver burnout is real. And when a caregiver collapses, emotionally, physically, financially, the person they're caring for suffers too. This isn't just about helping caregivers. It's about protecting seniors. All right, let's bring this home. You just learned about 5 major changes coming from the Elder Care and Senior Protection Act. Home care expansion, nursing home accountability, drug cost reductions, financial abuse protections, and caregiver support. This is real. This is happening. And the question is, will you take advantage of it, or will you let it pass you by? Here's your action plan. Write this down. Step 1. If you or a loved one is on Medicaid or might qualify, contact your state's Medicaid office and ask specifically about expanded home and community-based services. Ask what's new. Ask what you might now qualify for. Step 2. If you're on Medicare, review your Part D prescription drug plan. Open enrollment is October 15th to December 7th every single year. Don't miss it. Use Medicare.gov's Plan Finder. Compare your current plan to what's newly available. Step 3. If a loved one is in a nursing home, request their latest inspection report. Ask about staffing levels. You have the legal right to this information. Exercise it. Step 4. Have the financial conversation with your elderly parent or loved one. Set up bank account alerts. Know who they're working with financially. Protect them before something happens, not after. Step 5. If you're a family caregiver, talk to a tax professional about the new caregiver tax credit. Keep receipts. Document your expenses. Money you've already spent might be partially recoverable. Look, Congress doesn't always get things right. And this bill is not perfect. It will take time to roll out. Some states will implement it faster than others. Some people will slip through the cracks. But this is movement, real movement, in the right direction. And the people who benefit the most from this bill won't be the ones who waited. They'll be the ones who paid attention, took action, and made sure their family was protected. Your parents worked their entire lives. They raised you. They sacrificed for you. They built a life. They deserve dignity in their final years. They deserve safety. They deserve care. And so do you, when your time comes. Don't let this information go to waste. Share this video with someone who needs to hear it. Leave a comment below telling me, do you have an elderly parent you're worried about? Are you a caregiver yourself? This community is here for those conversations, and I'll be back with more breakdowns just like this one. Because this stuff matters too much to ignore. Stay informed, stay protected. I'll see you in the next one.